we haven't had any major breakthrough in terms of treating shingles infection, for a long time. And if something that can fulfill this unmet need, I think it's got a broad implication to how we treat shingles. The pain can be quite severe because the virus reactivates in the distribution of the nerve, and we know that nerve pain can be quite serious, especially in older people. I would say that more than half of the patients, around half the patients will actually present, from my own experience, people will present outside the therapeutic window for antiviral treatment, so outside the 72-hour window. And for people with more severe pain, then we start to look into more toxic options that may have medications that may have more side effects, so to speak. I don't think that what we have right now truly address all components of the shingles infection, and there's a need for another agent or something that can help us in our fight against this condition. Based on the limited numbers of participants that we have, we can say that my observation is that the medication has been safe. It does look like there's a trend towards pain, effective pain reduction. In my opinion, any pain reduction beyond what we have as a standard therapy is meaningful. So even a 10 to 25% reduction of pain in a patient, that's meaningful, especially when we consider the pros and cons of a medication. If medication is very toxic, then we need to weigh it up against the toxicity that we give to a patient in reducing the pain. If a product is very well tolerated and doesn't really add on in terms of burden or side effects to the patient, then even a modest reduction in pain, I think it's worth pursuing. Topical product in general is regarded as safer than a systemic product that we have to take orally, then expose the whole body to effects of the particular medication. So if there was a product that can actually bypass this window and address the limitation of this 72-hour window and then still work when the patient presents at day 4, day 5, or day 6, when they're still highly symptomatic, they're still experiencing pain, the rash is still very prominent. If we can give them something that changes the course of the conditions, I think that would be great. This would change the paradigm of shingles treatment, really, because now we have something to offer patients beyond the 72-hour window. We have something that potentially will be less toxic, that doesn't have to be taken orally, they can just apply and is well tolerated. And if the investigator product, Solexan, can be shown to reduce the duration and the pain, I think it will be used widely by clinicians.